Alright, so we are doing an intradermal TB demonstration for our patient Skip. And here's our orders, and then our MAR, and we wrote this order into the one time because that's what it is. And we're going to remember during this whole process to maintain the 6 rates of medication administration, so right medication, right route, right patient, right dose, right time, and right documentation. We're going to grab our Mantox injection and make sure we've got the right medication. We're going to inspect our vial, check for the lot and the expiration, which is good on this one. This one's been open, so we've got a time or a date and an initial saying that it was open. We want to make sure that we are checking the date that we can still use this, so it's either within 30 days or it's within hospital policy or manufacturer policy that we can use this. So this one is good. We're going to have our TB syringe. We are going to wash our hands. And we're going to use brand new alcohol swab. But we're using what we have. Clean off the top of our vial. Get our syringe ready. We're going to drop the air that we would need, and this injection calls for 0.1 mils. We'll draw that much air, which we got. We insert it into our vial, inject our air, and then withdraw our solution. Make sure that we have no bubbles. And then we want to carefully recap this one and bring it into the patient's room. Alright, and then we would label our medication with the name of the medication, the Mantox, 0.1 milligrams, and then we would double check our MAR, 0.1 mils, and then we'd go and give our injection. Let's go find our patient. Hi, Mr. Rocker. My name's Megan. I am going to be your nurse today. Dr. Junkie ordered a TB test just to rule out any health concerns that way. So this is an injection that goes into the skin of your forearm. We like to do it there just because there's usually really clear skin. It's very easy to see a reaction, so it's really important. Before we begin with that injection, can I check your name and have you verify your name and date of birth for me?
Skip Rocker, and then I was born January 1st of 1979.
Perfect. I see you have an allergy to Celebrex, and we're not giving you that, so we should be good to go. Alright, I'm going to wash my hands. Get some lovely gloves. Alright, and I'm going to look at your forearm here, Skip. Alright, so we're going to go right in here. In your forearm. We're going to be using a brand new alcohol swab. Clean off that area. And then we give this medication at a 5 to 15 degree angle with our bevel up. We go just under the skin. And we would want to see a 1/4 inch wheal or bleb. We'd only go 1/8 of an inch of our needle and pull it out. I'm going to safely recap this one because we don't have a sharps container in the room, but we would dispose this in a sharps container. We would draw a marker around our bleb so that we could note if there's any reaction. We could dab this, but we don't want to cover this with the Band-Aid because we want to be able to see the reaction. We don't want to risk there being any other reaction with like adhesives. So we'd mark this. Gloves, dispose of all of our goods, and we're going to document. 0830 initials, and I'm going to document that we gave it into his left forearm. That way, whoever gets to see Mr. Skip in 48 hours. Skip, you're going to need to return in 48 hours so we can check this spot. they know where to look for a reaction site. They should still be able to see my marking, the pen marking of where the injection was given, to see if any redness has spread or if there's any bumps or bruises or anything like that. All right, and then we make sure Skip is doing okay. Is there anything else I can get for you, Skip?
No, I'm good, thanks.
All right.